Welcome back to the show. It's your girl Sarah right here on the sunrise, and I'm very, very excited to be here on this beautiful day because it is a Monday morning. And I know Monday is not something that a lot of us are excited for, but I am very excited for Mondays. Unlike, I don't know, maybe you will frown upon me for this, but usually I'm very excited for Mondays, and I don't know why that is. I think it's because I'm very excited for the new week. I'm excited for the new possibilities and that this new week could bring, but also because today is Monday. It's the 19th of July, and it is finally the day that restrictions are lifted here in the United Kingdom, which means that finally we have a much better sense of freedom than we used to, especially maybe a few months back, maybe a few weeks back. Okay, so that is something to be excited for. But also, I love Mondays because it's always about the new opportunities. It's about all the new things that could happen in your life, all the positive things that could happen in your life, and how all those positive things are definitely going to help you, be more excited, be more hopeful for the future. Okay, and I know these days we haven't particularly been very hopeful. We haven't particularly been very excited about the future because of the pandemic, because of all these different things that we've had to face as humans. So that's not something we have been very hopeful about. But obviously right now, we're much, much more hopeful. We're much excited because things are slowly going back to normal. So you're tuned into Relax Radio, and it is, in fact, the final hour of the show. But don't worry, because I will be here again for the rest of this week until Friday to make sure I keep talking to you about everything that you go through, especially things related to your lifestyle, your mental health, your personal development. We will be talking about all of that right here on the Sunrise. So make sure you stay tuned and make sure to go follow us on our socials, which is Facebook, Instagram, Twitter, and TikTok. That way, you can actually make sure you're a part of the show. You can make sure that you share your thoughts, and also, you can make sure you're updated and informed about everything that happens, not just here in the United Kingdom, but anywhere in the world. So make sure you do that. And don't forget to follow, or rather download our app, which is available on both the Apple App Store and the Google Play Store. That way you can make sure that you can listen into the conversation from anywhere in the world at any time of the day. So make sure you do that. And also, don't forget to text me on 07852473473 to share your thoughts, to share your experiences, to share your opinions with me, because I would love to hear from you. Now, earlier, during my previous show, we were talking about loneliness, and I was having this absolutely amazing conversation about loneliness. These different perspectives, these different thoughts that people had about loneliness, why they felt the way they did, and it was an absolutely amazing conversation. So make sure you do that here as well, because mental health also, regardless of whether it's for pregnant women or men, is an important conversation to be having. So make sure you text me, make sure you let me know what you think about this, and let me know if you have been affected and if you've experienced this as well, because it would definitely help everyone who is listening in as well. So make sure you stay tuned. But right now, let's actually head into our conversation, which is basically about how pregnant women in England have in fact been denied mental health help because of COVID. Now, like I said, COVID was a difficult time for all of us, not just for me and you, but for a lot of people around the world, not just here in the United Kingdom, but everywhere in the world. COVID was a difficult, it brought back, or rather, it showed us how many issues that are there, how many issues are there within the world today, how COVID-19 in fact exacerbated some of these already existing issues, and why we, going forward, we need to focus on these issues, why we need to make sure that we try to address these issues as much as possible before we move forward and before we, move on to the future. Now, in the years 2020 to 2021, only 31,261 women out of 47,000 actually managed to access perinatal mental health services. Okay. And this is very, very important, because something that is there for some women, especially with regard to pregnancy, is they tend to have a depression, anxiety before and after the pregnancy, right? And sometimes these situations can be very, very bad. So it's very important for these women to get help, especially, because bringing in a child to this world, and because, especially when you're pregnant, there is a lot of changes, hormonal changes and other changes that happen in your body, that actually affects your mood, that affects the way you think, that affects the way you new things. And that's why it's important for pregnant women to get help. That's why it's important for our health sector. That's why it's important for us to focus on making sure these women get as much help as possible, because we need to make sure that they're healthy, that they are in a good mental space to actually raise children. Okay, because all these movies, the way movies and TV shows portray motherhood, they always portray it as this, happy-go-lucky situation where there's like a pot of gold at the end of the rainbow, which is really not the case, right? um Being a mother, having children, taking care of your children, and balancing all of the other 101 things you have to do is in fact something that is very, very hard, right? So obviously, when it comes to your mental health, and when it comes to the way your brain is working and the way you feel, those things need to be discussed, those things need to be spoken out, and people need to focus on it more, talk about it more, instead of stigmatizing it and making it look like it's possibly the worst thing for you to be doing, especially after you're pregnant, to talk about your feelings, right? So that's why it's important for us to actually talk about it. That's why it's important for us to make sure that we talk about it as much as possible, so we can spread awareness, but also make ourselves aware of the different ways in which in which pregnant women actually feel anxiety and depression during, or rather before and after their pregnancy. Okay, so thousands of pregnant women in England were in fact denied vital help for their mental health because of the pandemic. And this was actually said or shown from the analysis from leading psychiatrists. Okay, now in the years 2020 to 2021, 47,000 were in fact expected to access perinatal mental health services to help with conditions such as anxiety, depression during or after giving birth, but only 31,261 managed to get help in the most recent data for the 2020 calendar year only. And this was according to analysis from the Royal College of Psychiatrists. Okay, now this is a big problem. We know how much the pandemic changed the way things were. It meant that a lot of women who actually went to these clinics, who went to these places to get help in person, couldn't actually access some of them, right? This also meant that a lot of them had to do it virtually, and with struggling to balance all of taking care of your child, all the household chores, and sometimes not even having supportive partners. It actually made it very, very hard for all these pregnant women to handle some of the problems that they had. It made it very hard for these pregnant women to actually get help. And given the fact that not even too much of an allocation is made in terms of pregnant women and their mental health, that is a big issue right here in the United Kingdom as well. So, like I said, because only 31,000, roughly about 31,000 people actually managed to get help for their perinatal health conditions, or mental health conditions, that meant that a lot of other women out there couldn't actually get help. Now, up to 1 in 5 women have perinatal mental health problems, and these are problems such as depression, anxiety, and other conditions that occur during pregnancy in the first year after the birth of a child. Okay, and there is a lot of issues that a mother has to go through, a lot of things that mothers feel, especially the first year after they give birth, which is a very tough year, because you're still adjusting to your hormones getting back to normal, you're adjusting to the new life, you're adjusting to messy sleeping schedules. We know how hard it is to take care of children, especially newborn babies, because the sleeping schedules are different, their feeding schedules are different, and they just have their own clock before they actually get used to the way normal things work, right? But however, having said that, the Royal College of Psychiatrists actually also, they found out that the pandemic was not the sole reason that the mental health of thousands of women were overlooked. Okay, now there were so many reasons as to why mental health of pregnant women were overlooked pre-pandemic, but the pandemic was in fact one of the biggest reasons that it was overlooked as well. Now, variation in care across the country due to the lack of local investment in perinatal mental health services actually meant that many areas in England, where there were pregnant women and new others cannot in fact get support. And that is a big, big problem, right? Because when it comes to mental health support, when it comes to support, especially when it comes to, pregnant women and women who have newborn babies, that is something that we need to focus on, right? Because we're very big to talk about, we're big to talk about when we bring life into this world, right? We're always talking about, hey, it's always good to make children, it's always good to make sure you reproduce and we have a future generation and all of that. However, having said all of that, we still, even when it comes to us going on and on about how it's so good to have more kids, it's good to procreate and whatnot. When it comes to giving help to people who actually need help, especially young mothers, mothers who are pregnant, when it comes to giving them help, we absolutely turn a blind eye, or we just pretend like we're deaf and we can't, and we don't hear, or we can't hear that the problems they're going through. So why does this kind of mentality exist? Because we understand that no matter what age, no matter what gender, no matter what social circumstance you're in, mental health should be something that is accessible to everyone. It should be a basic need that everyone can access, especially in this day and age, especially right now, because a lot of us are having mental health problems because of the pandemic, because of how fast our things, how fast our lives have changed and how fast things have changed. It should in fact be a basic need, a necessity for people to survive, and it should be something that is available for a lot of people, right? So it's important for us to understand that in terms of giving help, in terms of getting help, and in terms of making sure mothers are actually okay, we have to play a much, much better role to make sure that they can access mental health, right? Now, Trudy Senaviratna, who's actually a registrar of the Royal College of Psychiatrists, said that staff in perinatal health care have made every effort to support women in these extremely challenging times, but services have been under unprecedented strain. And obviously, we understand that, especially in terms of the National Health Service, in terms of a lot of the other hospitals that deal with problems like this, they have in fact been overwhelmed because of the huge influx of COVID-19 patients. They have been overwhelmed by the amount of patients that have been coming in. And let's face it, let's agree and let's deal with it right now. A lot of those have been because of how careless we are. No matter how many times we were asked to wear masks, no matter how many times we were asked to social distance and sanitize, we still completely refuse to listen or even adhere to any of those regulations, and we kind of tried to go live our best life, and then ended up getting COVID, which then resulted in all these hospitals having an overwhelming amount of COVID-19 patients, right? So partly, we're a part of the problem as well, because if you're not going to listen to the if you're not going to listen to what the authorities say, whoever is in charge, if you're not going to listen to what they say, then things are going to get really bad for you. And that did happen. Okay, so make sure you stay tuned, because right now we're going to head into a small break, but after that, obviously, we'll be back to keep talking about mental health, especially in terms of pregnant women, and why we need to make sure that pregnant women do get mental health help services.
Again. But now, if you say to a child, if I went up to a child and said, "You've had one to forget," God, there'd be an inquest. Me, why did you reject my son? Oh, I haven't rejected your son.
I want to talk about, how the generation gap, has how much it's changed, especially when you check the youth nowadays in comparison, to people back in the day.
I'd say when I was younger, it was more disciplined. Not now.
In comparison to now.
Not at all. Not now. The way things are nowadays, the younger generation, you seem that they can't accept the word no. If that makes sense.
They can't accept rejection, essentially, is all you're trying to say.
Yeah, they can't accept the word no. So if you say, "How did I do?" Or "You didn't do very well," and they get upset. And when I was a youngster, my father used to say to me, because I used to be sport mad when I was very young. Well, I still am sport mad, but like participating in different sports. And if I had a bad game, for example, I'd say to me, "You had one to forget." That's it. You had
Your
one
dad sounds like a smart guy. I mean, yeah, that's the real fact of the matter. Yeah.
He said to me, you had one to forget. Get over it. And that was it. So I had to dust myself down and do it again. But now, if you say to a child, if I went up to a child and said, you've had one to forget, God, there'd be an inquest. An inquest. For me, why did you reject my son? Oh, I haven't rejected your son. Or daughter. I've just told them that they need to buck their ideas up.
That's the truth right there. I mean, if you think about it, if you check the generations, like right now in the US as well, I've seen a lot of these things as well. In the UK, you get medals for participation. But what's the point? What are you trying to? Yeah, what's the point? Either you win or you lose. People are so afraid to put that whole notion of losing. When it comes to right now, the generation gap is just crazy. How much a lot has changed. Social media has taken control of our lives, and we don't even realize it anymore. We're crippled because of it.
That's absolutely right, Nick. Because, as you said, nowadays it seems that you get rewarded for failure. For the life of me, Nick, I can't get my head around that. Perhaps I'm just getting old and morbid. I don't know. I just can't get my head around how you could be rewarded for failure.
Welcome back to the show. It's your girl Sarah right here on Relax Radio. Now we're having a very important and interesting conversation about how pregnant women in England have in fact been denied mental health help services, especially during the pandemic. Okay, so that's what we're talking about, and it's a very important conversation we're having because we know that during the pandemic, things have been hard for a lot of people, but obviously in terms of pregnant women, we need to make sure that we pay more attention to this problem and that we are more aware about this conversation moving forward. Okay, so that's why we are having this conversation. Now you're tuned into Relax Radio and you're listening to The Sunrise with your girl Sarah right here on Relax Radio. And it's in fact the final of the show, but don't worry because I will be here until the rest of the I will be here for the rest of this week until Friday to make sure I keep talking to you about the most interesting things and the most entertaining and informative things happening not just here in the United Kingdom but all around the world as well. So if you like some of the content that we talk about, go make sure you follow us on our socials, which is Facebook, Instagram, Twitter, and TikTok. Go follow us, like, and even comment, share our content with your friends because it's going to help you as well. And don't forget to download the app, which is available on both the Apple App Store and the Google Play Store. Make sure you download the app, make sure you're a part of the conversation, and make sure you're listening to the conversation at any time of the day from anywhere in the world. And don't forget to text me on 07852473473 so you can share your thoughts, you can share your opinions and ideas with me because that is something I would absolutely love to do. I would love to hear from you. I would love to hear your experiences about what we're talking about as well. Okay, so let's head back into the conversation. Now, like I said, Trudy Senaviratna, who's actually a registrar of the Royal College of Psychiatrists, said that staff in perinatal mental health care have in fact have made every effort to support women in these extremely challenging times, but services have been under unprecedented strain. So, funding for mental health facilities is long overdue, but is more urgent in the face of COVID-19 pandemic. Now, Vicky Nash, who's the head of policy campaigns and public affairs at Mind, said that the findings were in fact deeply concerning. And I do agree with her. The findings are very concerning, especially because we're talking about pregnant women. We're talking about how their mental health has been affected, and we know when you're a pregnant woman or when you are a mother with a newborn baby, things are very, very hard, especially with all the hormonal changes, the hormonal imbalances. There are so many things we need to focus on. There are so many changes we need to make sure that that these mothers, their babies are well protected. Right now, more broadly rather, women are among several groups that have borne the brunt of the COVID crisis, right? Because many of them have been juggling these caring roles with working and homeschooling that has in fact led to a deterioration in women's mental well-being. Okay, now let's face it, during the pandemic, how many of us actually, or how many instances did we see where when the mother was staying at home, we expected them to provide us with three, different meals for the three different meal times of the day. We expected them to do all the housework. We expected them to take care of the children and still do their jobs, and still expect them to be okay. But the truth is, at some point we're all going to break. At some point, some of us are going to break, and it does not make sense for us to keep expecting mothers or pregnant women to be completely okay with the way that things are going, right? And especially if you're someone who, if you are married and in your relationship you don't have a supportive partner, or your partner is just focused on their work, it gets very, very hard, and it gets very, very tough, because you have to bear that whole brunt of the COVID-19 crisis all by yourself. Okay, now the Royal College of Psychiatrists is in fact calling for funding in the next pending review, and the psychiatrists are also calling on local health bosses in certain areas to address long-standing funding issues. So funding is in fact one of the biggest issues in terms of mental health help. And the reason it's one of the biggest issues is obviously you can't move forward, you can't necessarily fund and provide a lot of mental health if you don't have money, right? And since we're so big on making sure mothers are safe, on making sure we have a lot of children in here in the United Kingdom, then we do obviously have a responsibility to make sure that we have services that are available for mothers, that are available for pregnant women, to make sure that they feel better, to make sure that they feel okay, and to make sure that they feel okay, and to make sure that their problems are solved, that their mental health problems are solved, and that they're given the help that they need, just to make sure that that they're doing better, especially in the middle of a pandemic. Okay, so it's important for there to be local funding. It's important to make sure that we try to allocate as many resources as we can, to make sure that it helps the mental health of mothers, of pregnant women, right? Now, perinatal mental health support was broadly on track before the pandemic. It was almost on track. And then it's sad to see it go off track so fast, so quickly, because of the pandemic, because of how many people were denied mental health help, right? Now, in the years 2019 to 2020, or rather the year 2019 to 2020, 30,625 women accessed perinatal mental health services, against the expectation of 32,000 outlined in the NHS long-term plan. Okay, and that's relatively good, right? Because about 30,000, 600 people managed to access perinatal mental health services, against the expectation of 32,000 that was there in the NHS long-term plan, right? And in all local areas in England, at least 7.1% of pregnant women and new mothers are in fact expected to need support from mental health services. Okay, and because about 7.1% of pregnant women and new mothers are in fact expected to need mental health support, it's important that we start funding, it's important that we start allocating the necessary resources to make sure that these mothers, to make sure that all of these young women who have children have enough of access to mental health help, right? Now let's actually also talk about a few stories, a few experiences of women, because we have to do that as well. Now, in North Central London, it happens to be the worst performing area in the country, with just 150 out of 1,521 pregnant women or new mothers expected to access specialist support managing to get it. Okay. And that's, about zero, that's actually about 1%. Okay. If my math is correct. And please do forgive me if my math is wrong, because I'm really bad at math. And sometimes when I try to do mental math, it really, I sometimes get it wrong quite often. But that's about 1% of women out there actually getting mental health help, right? And that's a huge problem, because we need to make sure that more women get mental health help, especially if we're talking about it in terms of, if we're talking about it in terms of making sure that these mothers are safer, making sure that these mothers have more access to mental health services, especially in the middle of a pandemic. Now, North Central London happens to be the worst place to actually get mental health help. And if you are going to, ask, and if you're going to, ask for these mothers to be safe, if you're going to ask for these mothers to have healthy deliveries, especially in terms of, delivering babies, then you need to make sure that they get as much access to health as much as they can. Okay, now let's also talk about Lean Howlett, who's actually 34 and has experienced postnatal depression after her first child was born 5 years ago. And also she had similar problems when her baby daughter was born in 2019. Now obviously the reason she has problems, or the reason she had problems with her baby daughter when she was born in 2019, was almost a few months, towards the end of 2019, or a few months, as soon as 2020 started, we had the pandemic, right? We had to deal with the pandemic. And because we had to deal with the pandemic, we had to actually make sure that um, the mother, the daughter, and everyone else, they had to change their lives around. So obviously, because of the pandemic, because of how things changed so much for a lot of people out there, Leanne Howlett actually also experienced similar symptoms of postnatal depression all the way back in 2019 as well, because of the environment around us, right? And however, this time she was struggling with her mental health as her daughter turned 5 months old, and the pandemic also struck, right? So obviously that's what we were saying. Because of how things have changed, because of the pandemic, and because of how our environment has changed as well, it's become very, very hard for young mothers who have newborn babies. So before coronavirus, she actually had a nurse coming to see her weekly at her house, and a psychiatrist appointment, and then overnight all of these face-to-face meetings switched to phone calls. Okay, now that's what Howlett said. And she said that it was harder to talk about big issues such as having suicidal thoughts remotely. Okay, because obviously in terms of suicidal thoughts, in terms of some of these things that you have to talk about with your doctor, it's definitely much harder for you to talk about how you've been feeling suicidal, how you've been experiencing these negative thoughts. It's definitely hard to talk about it through the phone than talking about it in person, right? And that's what a lot of mothers have had to face as well. And obviously, at that point of time, that is not, and we didn't really have an alternative to that problem, given the fact that it was just the beginning of the pandemic. We were still unsure, and we were unaware of what exactly it was like. So there was a lot of changes that we had to make. There was a lot of differences, and a lot of different things that we had to adjust to. So because of that, it was in fact very, very hard for her to remotely talk about her suicidal thoughts and her mental health problems over the phone and other ways, right? And another thing that she had to go through was she also lost the support of friends and family, and her son could no longer go into nursery, and that felt her leaving alone. Okay, or rather, that made her feel like she was feeling alone, rather, right? So the reason she felt that was obviously because of lockdown, because of how things had changed. You lose, not that you necessarily lose, but you can't contact, or you can't get in touch with the family the same way that you used to before the pandemic, right? Things change, right? So that means that when you are getting in touch with your family, that when you're changing things around, you have to make certain changes, you have to make certain differences, especially because of how we've all had to adjust to the pandemic. And that's the same thing that Leanne Howlett actually had to go through as well. She lost the support of her friends and her family, and her son couldn't go to nursery any longer because of the pandemic, because of lockdown, and because of all the other changes and adjustments that we had to go through. Okay. And after all of that, she felt like she was really on her own. Like, she felt like it was her all by herself. Even though, support was there, it just wasn't the same. Right. And the reason it wasn't the same, the reason she felt so different, she felt so alone, and she felt like she had to manage it all by herself, was obviously because talking to your practitioner, or talking to your therapist about the problems that you had over the phone is definitely much different than talking about it with them in person, right? And when it comes to talking about your problems, especially mental health problems, it's very important for you to try and have the conversation in person, because it does in fact trigger certain emotions, it does in fact trigger certain memories, and it helps you bring back those memories. It helps you understand better and fully why you felt that way. Okay, so make sure you stay tuned, because right now we're going to head into a small break, and after that we will be back to keep talking about how mental health is important, especially when we're talking about pregnant women, and why it's important for us to keep funding them, and why we need to keep talking about this. So make sure you stay tuned.
Cycling in London is not child's play. How to be a better cyclist. Listen to my show, only on Relaks Radio. I'm Kevin. Join me every Thursday, 5 p.m. Look forward to seeing you.
Welcome back to the show. It is the final few minutes of the sunrise, and you're hanging with me, Sarah, right here on Relax Radio. I'm very, very excited to be here, although it's the final few minutes of the show. But don't worry, because we're still, talking. We're still having a very important conversation about how pregnant women have been denied healthcare right here in the United Kingdom, and why that's a big problem, and why we need a lot of funding, especially in terms of making sure that these women are okay. So that's what we're talking about. And if you really like some of the content that we talk about, make sure to go follow us on our socials, which is Facebook, Instagram, Twitter, and TikTok, because that's definitely going to help you stay focused. It's definitely going to help you stay informed and educated and updated about everything that's happening in the, not just here in the United Kingdom, but also all around the world as well. So make sure you stay tuned, and also don't forget to go for to download our app, which is available on both the Apple App Store and the Google Play Store, because that's definitely going to help you to to be a part of this conversation and join in from anywhere in the world at any time of the day. And don't forget to text me on 078 to be a part of this conversation, to join this conversation and share your thoughts and opinions with me. With me during this conversation, okay? But right now, let's actually get back into the conversation, because we are talking about how pregnant women actually need mental health help in terms of dealing with perinatal depression and perinatal problems and whatnot, okay? So make sure you stay tuned. But earlier we were just talking about how it's very different for you to talk about your problems to your therapist in person versus on the phone, right? And because we've had to make everything almost virtual because of the changes from the pandemic, how this has actually affected in a lot of mothers who are going through similar problems in not wanting to reach out and ask for help, right? So we were talking about Leanne Howlett, who said she was feeling very alone. She felt like she couldn't. She felt like she was all by herself and she couldn't handle all of it. And she said that she was also worried that services would now permanently move to being provided via the telephone, right, through telephone calls. And she said that this meant that we needed much, much more funding. And she also worries that cuts to health visitors, noting that it is often during these health visitors that it's she noted that it's during these appointments that mothers reach out and ask for help, okay? So when you have these weighing clinics and whatnot, that's when mothers actually come with their babies, they reach out and they ask for help, because it is the weighing clinic that a lot of people reach out and they ask for help. They say, look, I have this problem, and the reason they do that is because a lot of other mothers there can actually relate to that situation as well, because those mothers too might be going through similar situations. Those mothers as well might be going through situations where they feel like they actually are going through a lot of pressure, where they feel like they're on their own and they can't solve their problems. So it's important that we still keep funding these places, right? Because Leanne actually said that she would not have picked up a phone to get help, and if there is no weighing clinics, then new mothers are not going to be seeing professionals face to face after having a baby, right? Now, an NHS spokesperson actually said that they have already ensured there is a specialist perinatal mental health service everywhere in the country, and as a part of their long-term plan, that they will continue to expand so that at least 66,000 women will be able to access specialist care every year by 2023, 2024. Okay, which I think is good. It's definitely going to help a lot of mothers out there who are struggling to open up, who are struggling to reach out and ask for help, because it's important for them to get that help they need, right? And especially if you are someone who's going to find it so hard to reach out to tell someone, look, I'm going through this problem and I need help. And the only way you would do that is through a weighing clinic, and that gets cut off too, then that's definitely not going to help you open up, right? And that means that will lead to higher rates of depression, higher rates of anxiety, and even sometimes suicide in terms of mothers who are going through perinatal depression, in terms of young mothers and even pregnant women, right? So the expansion that is going to be a part of the long term plan of the NHS is actually going to include, you know it will include it rather recently announced that they will be bringing hubs together for maternity services, and they will also have services that include reproductive health and psychological therapy under one roof for women who have mental health needs as a result of their maternity experience. Okay, so that's important, and that's definitely, they're definitely going a step forward in terms of, dealing with these problems, in terms of making sure that mental health help is accessible to all of the mothers here in the United Kingdom, and to make sure that they will have a much safer transition from from normal life to motherhood, versus, being a mother and having to juggle all of the 101 things that our mothers struggle with, especially after having kids. Okay, so I really, really hope you enjoy this conversation. I really hope that you got to learn something, that you got to, be informed and be aware of something that is happening here in the United Kingdom, and something that is a big problem here in the United Kingdom as well, especially during the pandemic. So it's time for me to head out of here and make way for Jamie on the chat trap, but make sure you stay tuned, because she also has a lot of fun and interesting conversation, so make sure you stay tuned. But I'm gonna head out of here, and I hope you have a very, very good day, and I hope you have a very good rest of the week as well.